The fastest growing segment of our population, people over 50, have an opportunity today to transform the way they stay healthy. Instead of just treating health problems, we can manage and even prevent some of the common ailments that come with aging. A new organization called Juniper has put together a network of programs to help people manage their health challenges, whether it's a chronic condition, diabetes prevention, maintaining physical balance, or just keeping a healthier lifestyle. I'm Cindy Mercado. I'm over 50, and I know that well-being is more important than ever and harder than ever to achieve. But there's medical evidence that being proactive about our health delivers results that go beyond just feeling better. Dr. Jane Peterson is the Chief Medical Quality Officer for Stratus Health in Bloomington. Through her extensive work in geriatric medicine, she's learned of these evidence-based programs and has seen the proof that they work. How do these classes differ from the traditional healthcare system?
Well, in the traditional system, people go in to see their physician or whatever provider, maybe a dietitian, nurse practitioner, whatever clinician they're visiting with. And that person's really helping them sort of set the plan of care. What are we trying to accomplish? What are the goals? What are we going to do? Unfortunately, then when that person leaves the office, they're kind of on their own to implement that plan of care. And that's oftentimes where people struggle. They think they understand what they're supposed to do, but then something happens, or they don't remember, or they're running into trouble, and they don't necessarily have someone to turn to. These classes really can help provide that infrastructure so that people can be successful in doing that plan.
How do you define evidence-based programming?
When I think about evidence-based programs, it means that there's been some work done to assure that whatever the intervention, and by that I mean whatever information is being shared as a class or as part of the program, has actually been shown to make a difference. There's a lot of information out there that people can turn to, and some of it is just public opinion. Some of it's good, some of it's bad. It's hard to differentiate those things. And so an evidence-based program, someone's really taken the time to say, is this information helpful, and has it actually been shown to give the outcome that we want, to give people the help that they're looking for?
3. Maintaining our balance is one of the first indications that we're not as young as we used to be. In the class called A Matter of Balance at the Eastside Neighborhood Services in Minneapolis, instructor Gloria Coles helps participants identify the risk factors of falling and the moves that can prevent or at least soften that fall.
We teach a variety of things. We teach about, number one, being aware. It's about awareness. We help people to learn about their surroundings, about the impact that medication can have. And we also teach about strength and flexibility, because some people think that just balance is just oh so easy. And for a lot of people, as they mature, balance becomes one of the most difficult things for them. Even though in your mind, you still think that you're 19, 21, your body tells you differently. And so it's learning to appreciate where you are and to develop the strength to continue, because our goal is to help people to live independently and to stay in their homes for as long as possible.
Now, what are some of the challenges that you think that the participants face when they take these classes?
One of the major challenges that people face is that they want to know that, why am I here? Or they'll think that their story is unique. They'll think that, oh, this is only happening to me. And then the camaraderie that develops from the classes, people start to see, it's like, oh, wow, I'm not alone. And so in the beginning, people are more shy and more personal, more private about their situations. But as the class develops, people are like, oh, wow, I had that happen to me too. Oh, wow. And it's like a moment of, oh, wow moments.
Participant Esther has experienced those moments, taking the balance class every week for 8 weeks. Combined with lifestyle and diet modifications, she says it's transformed her life.
It changed me and letting me know that I was headed in the right direction. It allowed me to see from the different classes that we took, I say awareness of all things, awareness of how my home is situated, awareness of things around me wherever I go, awareness of what I am doing, and if by any chance that a fall might, be inevitable, how do I respond to that without hitting the ground? So that was, I think, the best thing for me. How do I respond to what I had learned without hitting the ground? Sometimes you might have to hit the ground, but then we still got to get up.
Keeping proactive about health is especially challenging with chronic pain. An evidence-based program in the Juniper organization addresses this. It's called Living Well with Chronic Conditions, offered at the Arrowhead Agency on Aging in Duluth. The class gave participant Francesca real-life application of advice she'd heard elsewhere.
I am chronically anxious and depressed. I mean, I'm under medication, so it doesn't affect my life, but I thought, well, anything that I could learn that would help me more with this, I would do. Meditation was really helpful, and it's not that I don't know about it or anything, I just didn't have little tapes and stuff, but I just wasn't doing it. And then they gave us a CD with good meditation stories on them, and I found that really helpful. It was the sharing too. It just didn't feel so isolating for you to have a problem that has been going on for years. So, it was that I really liked all of it, but that was a special part too.
Kimberly Scanlon, who leads the class, has a background in psychology. What kind of tools are we talking about here?
Anything from problem solving, learning how to make decisions, communication skills, and making action plans so that they have small, achievable steps toward their goals.
And so these are people who have chronic conditions. How do these tools work for them?
Oh, they work in a number of ways. I would say most importantly, it helps them realize that there are things they can do to help themselves. And so this goes along with whatever their care provider says or their physician has said. It helps them become their own self-manager.
What kind of participants do you attract to these classes?
We see a lot of older adults that like to participate in these classes, but it's also their caretakers, their family members, their spouses, anybody with a chronic condition such as diabetes, colitis, depression. I would recommend anybody and everybody to take these classes. It really helps anybody. Older adults, their caretakers, their loved ones, friends, neighbors, spouses, anybody who has a condition that they want to learn more about or discover something within themselves, or maybe utilize peers to gain some more strengths.
Juniper is now working to ensure access statewide to evidence-based programs. Juniper is comprised of the 7 Minnesota area agencies on aging and is collaborating with health plans, long-term care and housing providers, and other community-based organizations to create a marketplace where people over 50 can find these new approaches to staying healthy. The goal is to establish a framework for best practices. Juniper then can collect and share the results of participation to improve outcomes. You can find online listings of current classes statewide by type, date, and location, and then register online. Just go to yourjuniper.org. Whatever the challenges of aging, you'll find help for an active, healthy future.